Hi, Dr. Arnulf Stenzl. Thank you for this meeting, for your topics on bladder cancer and prostate cancer. What are your first impressions of this meeting?
Well, thanks, first of all, Martha, for doing this interview and allowing me to give you some impressions about this meeting. It's a large meeting. I've been to previous meetings of the SMU, and it's always been a good meeting, but I think it's getting even better. It's more improved, and I see a lot of people here.
Yes, it's growing each year.
Yeah.
So I know that you have been an author and co-author of maybe 800 publications or more all the way through your career. Um, can you tell us, to the audience as well, what would you consider about the artificial intelligence and prostate cancer?
Well, as you know, artificial intelligence over the last few years have been increasingly used in medicine. Actually, most recently with like ChatGPT and Chatbox and others. And we need that. We need that for a patient's education, for especially, and that is what my main field is, in getting a good overview of the literature, of the current literature. If you think there is on average 10,000 papers per year published on prostate cancer. And if you, as a clinician, have a certain question on an individual patient, it would take you days, weeks to get through all the literature until you sorted out what is important for your patients. And for that reason, we have tried to create ways, platforms to go through specific patients-oriented literature, for example, in the sequencing of prostate cancer, and within a short time we you will get the answer, and you will get the answer in a sheet of paper with the conclusions of the relevant papers. So that really makes it more practical
Easier.
into for the clinician, and
Oh,
that is
good.
and of course then there are other ways of like translating our doctor's language into the patient's language, and so that we have, when the patient is onboarding, we have the possibility to educate the patient in his language before he sees you, and then when you discuss the different ways of treating a certain disease, such as prostate cancer or other complex treatments in urology, then he already has an idea. He knows what he might expect from each of the treatment and what type of disease he has. And so it is much better for the decision making, shared decision making for the patient. But on the other hand, it reduces the time you need to explain everything.
Good, very interesting and very useful. Um, what would you say if you could change one thing in our field? I mean, hypothetically, or maybe you are wondering, like, oh, I want this, or what would you change?
I think that we need to get a better way of exchanging our experience over the years with certain special cases. And to do that, you would have to have a hub, a registry like thing where all the different cases are then put in, and with the help of AI again, you may then really see what the experience was in very specific cases, which are not really seen in guidelines or in books, because we always have an overview and we always have those guidelines based on prospective randomized data, but we don't have it on the more individualized cases. And there are, in different regions, in different countries, and with different constitution of patients, there will be different ways of how the treatment is expressed, how it may be diagnosed, and then how can we get the best treatment.
Wow, yeah, That's great. Would you like to invite us to the next EAU meeting? Can you tell us more about your objectives, your goals?
Sure, absolutely. I mean, the European Association of Urology meeting every year is, at least in Europe, a highlight, and it's worldwide one of the biggest meetings in urology. And we also see an increase in, again, after the pandemic, of delegates to this meeting from all over the world. And we have plenary sessions for next year on prehabilitation prior to surgery, intraoperative management, postoperative care updated. We have, like in uro-oncology as well as in functional urology, we have excellent speakers and excellent data on the most recent data, especially uro-oncology. You know, there's so much going on, so that with every month you have something new coming up, and especially now nuclear medicine with the PET-CT, PSMA PET-CT for prostate cancer, but not only diagnosis, also treatment. We're seeing now that treatment may be done maybe with ligand therapy in prostate cancer in an earlier disease. And in bladder cancer, we see that there is more effective, more stronger systemic therapy, that after 40, 50 years using cisplatinum-based therapy, all of a sudden we have several new drugs that have stunning results, and stunning results that will lead to avoiding cystectomy in some cases, which is really beneficial for the patients. But for us urologists, we have to really educate ourselves, because otherwise we will be somehow directed by others, by other disciplines, if we don't know about it. We have to be in a discussion, for example, in a multidisciplinary tumor board, we have to be eye level with all the other ones to the benefit of the patient.
Okay, good. So we'll see you in Madrid.
Yeah, hopefully we'll have a strong, presence of Mexican urologists, like we always have. We really like that. Nice contributions also. We have a record number of close to 6,000 abstracts submitted this year. And after this meeting, I'll be in Amsterdam for the abstract selection meeting, and I'm sure there will be nice Mexican contributions to that.
We hope
Looking
so.
forward, yeah.
Thank you very much, Doctor.
Thank you very much, Martha.